recording. So whoever finish your sessions, please make your shake while listen to these sessions, yeah? And I'm gonna to invite our awesome Dr. Samantha. Are you around?
Hi, yes. Hi, everybody. Sorry, just let me start my video. Hi, everybody. Nice to meet all of you.
Let me, okay, hold on. Let me, speaking and myself as well. So like, great. And everyone, type 1 and type 2. 1 is have you heard about chiropractor before? And if yes, type 1. If never, type 2. And then what does that work for you, right? Okay, so I'm a bit nervous as well, but no problem. So this session is all about, how to, a lot of us actually been doing workout. And then at the same time, we're doing workout, but we don't know is the posture right. Sometimes you get ourselves like cramping, and immediately they thought of is go to the doctor, right? But like, but I understand also is instead of going to the normal general practice doctor, we can go to someone like you, and then also physio, right? So Dr. Sam, wanted to ask you a couple questions first. How you get into your chiropractor right at the beginning?
Okay, so I've been a chiropractor now, practicing for 6 years, and including studies and everything, that would be 4. So I've been doing this 10 years now. I became a chiropractor because when I was much younger, I think I was about 12. My mom had a very serious lower back injury. So she had no idea where it came from. My mom's just a housewife. She's not even as active as you all. She just one day woke up, couldn't walk, very painful and all those kind of things. So I remember it quite clearly because I was old enough to understand that mom couldn't do things, right? And it was a big drama in the house. I've got many siblings. I'm one of 5. So you can imagine the big cut in life because mom can't move, it's a big drama. And what happened was she went to many doctors, as you have mentioned. She's gone to orthopedic surgeons and all these kind of things, and they found out she had a slip disc. So of course, then surgeons recommend surgery, things like that, which she didn't want to do, right? Like I said, we have 5 of us, and she was very worried that life would be interrupted because of this problem. So she ended up going to a chiropractor in Klang ages ago, where I'm from. And she ended up getting so much better so quickly. I remember her telling me things like, wow, this chiropractor is like a miracle for her. And I used to think, okay, what is this thing? So when I ended up going to the chiropractor myself, I just, follow mom after school, that kind of thing. And I was sitting in the corner. The chiropractor looks at me, and I was about 11, 12 years old. And he's like, oh, I think my mom's name is Pansy. He was like, Pansy, I think your daughter sits funny. She sits a bit crooked. And like, I think maybe she has what we call a scoliosis. And so then he was like, would you like to give your daughter an adjustment? Would you like to try? And like I said, I was only maybe 11, 10, 12 years old, around there. And mom said, yeah, sure, why not, And so after trying, I felt, and this was personal for me, it was like everything was lifted and I felt so much better. And as a teenager or as a child, you don't really understand what pain is. You know what I mean? You don't really know why you have pain. You just always feel a bit achy and sore. And so some of us here, maybe we have friends, we have kids, and they also tell us like, always want a massage. Some people always feel like they want a massage and you don't understand why. But after getting adjustment at that age, I realized, wow, this is something really special. And I saw how it changed for my mom. And, back then chiropractic wasn't really well known. So we had to really look into it, find out research about it. Turns out it's one of the 3 biggest practices in America. And chiropractic is very based in research and it's very based in anatomy. And so we felt more secure knowing it wasn't just some, some guru or some sifu who teach you, some master somewhere, right? And so then we moved into looking into it as I grew up. And so when the opportunity came for me to be able to study it, I took the opportunity.
Wow. Yeah. So like for everyone here, type me if you have that experience that you're constantly feeling like something around your body. You feel like, how come I'm so tired, or like there's an ache or injury or like pain somewhere, right? So like listen to this. And so Dr. Sam, I wanted to ask you, after you learn and you study all this, right? And what is the common patient would come to you?
Yeah, so it depends. So I have a wide range of patients. So maybe I can share my slide and it would be quite clear because I have a little bit about me on it. Yeah, so this was what I said, but as you can see, my patients range from a baby, like I've seen babies at 1 month old or even 1 year old. Maybe they have colic issues, they have stomach gastritis issues. Like babies, sometimes they because it's developed, but then they pull when they pull the baby out, even if it's a natural birth, it's very traumatic. So we can see babies, but we can also see adults. I also see pregnancy-related back pain. But most of the time in clinic, very commonly, I see upper back and neck pain, thanks to the computer, thanks to the laptop, thanks to our phones, and of course, lower back pain due to sitting and stuff like that. But so that's the common stuff. But I also specialize in nerve-related pain. So for example, if you feel pain and you get numbness and tingling in your hands, or you feel pain and you get numbness and tingling going down your legs, that kind of thing, that's what I specialize in, because it's very important to know where it comes from, not just blame the nerves or blame the muscle. A lot of times it's just joint related. But yeah.
Mm. And then, that is the reason I met Dr. Sam. At the beginning, we wanted to collaborations, right? But I told Dr. Sam about, I have this numbness on my toe and my leg. And then I think it's some problem of my nerve or like my tailbone or something like that, right?
Yep.
So like she said, no problem. Why don't you come and do an assessment and have a look? And then she realized actually it's on my, can you share? You're more professional.
For me to share, sure.
Yeah, what is my problem?
So basically when Yan came in, she had pain going down her legs and a little bit around the front as well of the thigh. And you didn't know where it was coming from. You even felt it in your knee. I remember you said when you sit down, it would lock and then you couldn't get up. And so in those kind of situations, a lot of people start thinking, oh, it must be a nerve-related pain. It must be sciatica, slip disc, and people start thinking very far, because if you Google online, that's what comes out. But the truth is, a lot of times our problems come from our glutes. And it's quite, it's one of those things where, I mean, even when I was talking to Yan, it's like you work out so much, you are so active, but then you have this issue. Right. And it happens to everybody, even as a chiropractor, I have pain. So it happens to anybody because we all have the same things that we have to do, sitting and stuff like that. So maybe I could show you guys the iPad and Yan, and this was what I showed Yan the other time.
Sure.
So we have two kinds of muscles in our body. We have deep muscles that go along the spine. So let me see if I can get this to, yeah. So that's quite clear, right? That's our spine. So with our deep muscles, it goes along the spine. So it's all these ones that come along the spine. And then we have superficial muscles, which are on the outside of the spine. So with the deep muscles, they are for posture and structure, while superficial muscles are for movement and things like that. So when you do sports, when you run, when you jump, you tend to be using a lot of superficial muscles, which are very important, don't get me wrong, but the deep muscles are what we usually engage in. And so if you sit for very long, your deep muscles end up sleeping, and they don't end up engaging when you need them to. So with Yan's issue, a lot of it was actually coming from a deep muscle down here called the glute medius. So let me click it for you guys. Okay, so you can see it. So the glute medius is actually meant for posture and structure and for being able to sit properly or being able to run and move properly. If that muscle has an issue, it tends to sort of affect all the deep muscles around it, around this area in the lower back and everything. So you have all these issues here, and sometimes it even goes down the leg. Yeah, wow. So it compensates that way. It could be a muscle, but then it ends up becoming a nerve, and then it becomes a whole issue because your lower back doesn't move properly, your joints don't move properly. Yeah, so that was what happened with you, Yan.
So listen to this, everyone. If you have type me, if it's like, yes, I have that issues, and then over exercise, or like you have this pain, lower back pain, and then you can't go away, and numbness around your leg, front leg or back leg, type it, this is me, right? Because that is the issue I didn't know until I went to see Dr. Sam, right? And is it really common to have like a spot injury?
Oh, very common. So with sports injury, especially from the work from home situation, everybody has tried to do things online themselves, which is really good. And I think in Malaysia, we're really seeing a shift in people being active, right? Like before this, how often do you see people jogging? How often do you see people doing stuff online? Very rare, because Malaysians love to just sit and eat. So now people are shifting into like, okay, maybe we should also do sports, maybe we should also exercise. But the problem is that with sports injury, if you don't solve it quite quickly when it's an acute stage, your body will adapt. And when it adapts, it compensates.
Yeah.
And then it becomes, instead of, oh, it was an elbow thing from maybe doing a push-up, it becomes a shoulder issue because your muscles are all collected. Or maybe when you're doing a sit-up, instead of using your core muscles to lift you up, your form is wrong, right? You end up using your neck, and then you have headaches. Like it just progresses quite quickly into something totally different. But it could have all started from a very simple sports thing, like instead of doing a plank and watching your form, you end up dropping your neck, you know? Yeah. Recently, I have some clients from running. They go jogging, and when they run, they don't keep their posture straight. They keep their neck a little bit forward, and then they have neck pain.
Oh, I see.
Yeah, and they come in with these tight shoulders, and they're like, Sam, I don't know why, I don't know why I have these tight shoulders. And so we try to figure it out. And the next thing you know, it's something so simple like from running.
So like, guys, listen to this. It's very, very important to work on your posture while you're doing exercise. It's not just about how many reps you do, but more importantly, it's your form. If your form is not right for long term, you will create this long-term with issues, which is and slowly you start worry, and it's like, is something wrong with me? But actually it's just the form, right? So like if doing MCO, there's a lot of people also sitting, using computer. And then do you have like find any common, like getting more people come to you because of like sitting, all these issues, long sitting?
Yeah, definitely. I would say when it comes to MCO and sitting, I'll show you guys another slide, which was research that was done in the recent years. Let me just get that. So just recently, because of MCO, I think they said something like 70% of people have more pain than before. So yeah. So according to a survey, 20,000 people, in the end, 70% of people, because of working from home, end up having more pain than before, which I think is quite, it's quite intense. It's quite a lot. Oops, sorry. Yeah, so it's quite a lot of pain, right? So what kind of pain do people get? Now they get back pain, they get neck pain. Previously, maybe you just get soreness once in a while, but now it gets worse. And I always tell clients, when you look at this slide, the scary thing is that it was taken May 2020, which was a year ago. And the whole world went into lockdown maybe in about April. So this was just a month into lockdown. At this point in Malaysia, we've been in lockdown for a year. And so it's just been so much stuff building on top and on top of compensation. And of course, in between, people try to find solutions for it, exercise, stretching. But in a long run, I think it will really harm our posture.
Yeah. So I saw the photo just now, the previous slide. Can you show? That's quite interesting. Oh my goodness. Can you share a little bit about this?
Yeah, so basically what we always tell clients is, whether you believe in evolution or not, one thing's for sure is that we are not in our correct posture, right? Our human bodies are meant for movement. They are meant to be standing upright. You can tell just based on how the structures are, right? It's meant for stretching. It's meant for, that's why nowadays what animal flow and things like that is so popular when it comes to exercise, because they want to get back to the movements that we could do with what our body is given. But if you look far right, that's probably where we are, right? Monday to Friday, we sit at a computer, and then after that, we go back to our room, and then we sit at our iPad. If you have kids, you are even more worried, because the kids are born in a computer age or with the iPad in their hand. And if now with school not going back, this is all they do. They don't run, they don't meet anybody. And so that's why even with children, recently we've seen an increase in cases in about the 14, 15, 16-year-olds. Yeah, the parents are a bit worried because it's starting to be obvious that they're just, sitting all the time.
Yeah. And so what are the things we can do if this is the generation we have to face
Yeah.
the fact, right? But at the same time, what can we do to avoid to have all these issues or try to reduce it?
Yeah, so with chiropractic, what we always tell people is we try to avoid, for example, surgery or some kind of intervention that is quite invasive, right? Whether it's injections or steroid jabs and stuff like that. Although we have find sometimes if it's very serious, we do recommend that you take some painkillers and then we go with the care to sort of reduce it. But most of the time, the best way is to keep moving. That's why, so for all of you here today, you're actually doing the best thing that you can for your back, which is to exercise, which is to keep moving, to keep stretching, to keep the movement and the mobility. So when it comes to our spine, there are movement patterns that the spine can do. And sometimes it gets stuck because the muscles are just over tense or overstretched, and that's where you have pain. So with chiropractic, we move the spine or we adjust the spine so that for people who can't move or can't do certain mobility, we help you do the mobilization basically. Yeah. So a healthy spine has very good mobilization. You should be able to, turn fully, have full range of motion, but some people stuck, right? So that's where the chiro comes in and they take you through the full ranges of motion. So that when you go back for classes with Yen, for example, you can fully do what she's asking you to do. Yeah, with no restriction and no compensation.
So what Dr. Sam is meaning is if we turn our head, we have pain or like how to measure that? What should we do to measure to see if we have any issues?
Okay. Simply said, most of the time we tell clients is when it comes to range of motion, everybody has different range. My neck will be different from yours. And that's why pillows, just FYI, or beds, usually it doesn't match. Even husband and wife, especially husband and wife, you cannot just use the same pillow because you're totally different genetically, right? So that's why you could buy pillows and very commonly they say, oh, we bought new pillows. My husband is fine. I cannot tahan. Or like, I'm fine, but my son cannot, and because everybody is different. And everybody's neck length, hip, and everything is different. So when it comes to range of motion, there is a healthy range of motion, and then there is unhealthy range of motion. But there isn't a specific range that you should do. Most of the time, what we say it's about 45 degrees down, 60 degrees back, about 45, and this one can usually go a bit more about 60. So it depends on people.
Okay, yeah. So like this.
Yeah.
And then to the front.
Yeah. So when you do these ranges of motion, it's normal to feel a little bit of stretch, a little bit of tension. But if you see in the mirror and you turn one side, let's say you can go all the way, the other one you're like, oh, stuck already or something, then you probably have an issue somewhere. That's a simple thing to look at.
Yeah. So like for your info, I got that. I used to can't turn my neck. It's just like, I feel pain here. So like I have this issues around my neck all the way down to my shoulder. That was me. Yeah. And what about the leg or lower back? If people have
same thing. So with the lower back, they said you can bend down towards your toes. But with that said, I will say though, not everybody can bend down and touch their toes. Everybody thinks they should be able to, but not everybody can. So usually when people bend down, it's more of seeing if how the back looks when they bend. And it should be a smooth motion. And you shouldn't have problems in your lower back when you bend down towards your toes. Some people feel the stretch in their hamstrings. And that's where, for example, going for stretch classes, things like that would help. But naturally, some people just can't. And then same thing with bending backwards and bending from side to side. I would also put it out there very quickly that hypermobility is actually quite dangerous. So some people, when they go for ballet and stuff like that, you're very hypermobile. Some dancers, they're hypermobile also, right? So that means that they can do all these splits. They can really stretch their legs. And then they say, oh, I don't know why I have so much pain. I am so flexible. I don't know if you've heard of that before, but some people are so flexible. They do yoga and everything, but they have pain. And they're saying, I don't know why I have pain because I'm so flexible. I should be fine. But the truth is because you are hypermobile, so your ligaments have an elasticity, right? Ligaments are like rubber band. If you overstretch it, you have a problem because your rubber band, it's like a rubber band. When it's overstretched, it doesn't snap back together. So it's a different kind of issue. That's the same thing that happens with people who crack their own neck.
Yeah.
So some people crack their own neck and then they say, well, I just keep cracking it, but it just has pain. It's because you're actually just overstretching certain ligaments, and the correct joints that need to move don't move. Very common in the hips and in the neck, especially with women, pregnancy cases, things like that.
Wow.
Yeah.
So there's a lot of things we have to learn to protect ourselves. And then later on, we're going to answer some of the question in the chat box.
Yes.
But before that, is there anything like I saw your slide just now? Is there anything you would like to share with the audience, which is in terms of like prolonged the sitting or like a spot injury and stuff like that?
Yeah, let me just run through something very quickly. I think just basic stuff like what is posture and how does that make a difference for you? So just give me a second. That would be great. Yeah.
Because I think all of us wanted to learn and improve ourselves. In this group, everyone joining in, they wanted to become the better version of themselves, wanted to learn how to improve. Yes. Yeah. So a basic question always is, what is posture? Right? So everybody knows sitting and standing, there is a specific kind of posture. You want to sit. Okay, so with sitting, for example, most of the time we sit and we just like lean back. So I always tell clients, actually, you should be sitting not on the edge of your chair, but you shouldn't be leaning back. You should sort of be sitting forward a little bit. Legs usually can touch the ground. So that's where, for example, in this picture, we put a back joy in because that's how you can imagine the sitting position to be. But there are also times where you can learn to do this just muscularly and just with practice. So that, for example, and clients will tell me, oh, after getting adjusted, I feel like I'm sitting on both butt cheeks. I've also heard that before. It's a funny thing, but it's how you know that it's equal, right? Standing up straight, of course, we all know our ears to our shoulders to our ankles, and it should relatively be straight and don't hunch over. But with sleeping, like I mentioned before, a lot of people are very concerned, how do I sleep? Sleep straight up, face down, things like that. I usually tell clients, however you can sleep is okay, except for facing down. Because when you face down, your neck, you have to breathe, right? So your face has to be turning one side or the other the whole night. And when you do that, that means that it's overstretched on one side or the other the whole night. And that's not good. But other than that, sleeping sideways, things like that, as long as your spine's aligned, you can put a small pillow, bolster, stuff like that, that's okay. And then of course with movement, which is the last one, where with your class, it's very important. A lot of people don't think about it when they run, like I said, or when they do exercise, they don't realize they have to engage their core, and so then they have pain. So posture is quite important, not just with the stationary things, but also with movement. And I have another one next where I show you what the spine looks like. So I think it's important that everybody knows what a spine looks like. Slow. Okay, so you see it spinning, right? So a spine has curves. So it curves in the neck, curves out slightly in the upper back, and curves in again in the lower back. These curves help distribute weight. So for example, if you run, if you jump, things like that, the curves help distribute so that it doesn't put too much pressure on any end, any transition joint. In between, we have all the discs, which act as like shock absorbers in the process also. So this is what the spine should look like. Usually, if you sit in the wrong position, I'll show you a slide later, you'll see what happens with the neck. And when you sit and it hunches over, why you have pain in the neck and the upper back as well. And also as a chiropractor, it's also why we always talk about the spine and your nervous system. It's because it really links everything in your body from your brain. And with the spine, it helps you taste, it helps you see, it helps you smell. And when something has a problem and when the power goes out, is how we describe it, means something is not connected properly. You get the back pain, the head pain, then, all these kind of nerve disorders, metabolic diseases. As mentioned, with kids and babies, they could even have colic, gastritis, stomach issues at a very young age due to the nerve disorders. This one, I always tell clients, it's like if you turn on a water pipe and there's a hose, right, that goes all the way to your car to wash, for example. If nothing presses on the pipe or nothing presses on the hose, the water comes out as usual. If at any point you squeeze the nerve wrongly or you squeeze the hose wrongly, the water comes out like crazy. So the water could be shooting out, and that could be pain, for example, electrical feelings in your fingers, stuff like that. Or
It could be compressed. And when it's compressed, you could have less water come out or even no water come out. That's a bit like numbness, tingling, ant feeling in your fingers. And that's a good example or a good imagination of how our body works. So this is our very common posture. As Yan was asking, what is the most common thing? And I was thinking, okay, what is the most common thing? I think this one everybody can relate to. It's called eye posture. It's called tech snack. It's so many different names nowadays because it's technology driven. Yeah. And this one, I think it's relatable, not just for work from home time, even when it's not work from home. This is honestly something we all go through. I think when I get into a lift and I don't want to look up and look at people, I look down at my phone, and it happens very commonly. Yeah. So look at the slide, you can see how it shifts from a curved neck posture to it becomes straight. And over time, if you keep looking down, your neck, your muscles get tired. It tells your brain starts shifting, and then your bones start going forward. So you'd be surprised how many kids come in with forward neck posture. Because same thing, kids, they recover very fast, but they adapt very fast. So if they think that this is how they should be, their neck starts moving forward very quickly. No degeneration usually in children, but the posture will be there and it's bad. Yeah. But in adult cases, this is what we call spondylosis. So there are different stages. So the normal one is where your neck is curved. Stage 1 is usually where most people are. I'll be quite honest. I think even me, kids, like I said, they tend to have these kind of issues. And then stage 2, stage 3 is when it gets really bad, when you start getting degeneration and things like that. There are also people who naturally have stage 1, which is where I am, because we have scoliosis. So our spine isn't straight, our spine is curved. So this is again like genetically linked, right? So if you have young kids, and that's why I had pain when I was younger, when I was maybe 10, 9, 11, I didn't even realize it, but I was already sore because genetically my spine isn't straight. And so somehow my body has to compensate. And so my neck ends up taking the brunt of it. So personally, my neck, my upper back, with my job looking down quite a lot, if I don't exercise it, if I don't do my proper stretches, oh, I have pain every other day. It's really annoying as a chiropractor because you can't crack yourself. You have to go ask your friend, you have to, get help. But the good news is that if I exercise properly, if I do my correct, if I do the correct posture, if I do the correct form when I do my planks and things like that, it is all completely avoidable.
Wow.
Yeah. So these are the kind of things that everybody goes through, I would say.
I see. So so for some of you, if you join our exercise, and our coaches always tell you, engage your core and then roll your shoulder blade, right? Because if your form is always hinge your back, whatever posture you do, like workout you do, it doesn't give you that kind of result you want. In fact, it will hurt yourself, right? For it's a long-term injury. So like so just now you were saying about engaging your engaging your core. Do you think develop muscle is also important for?
Oh yeah, for sure. For sure. So like I mentioned with the deep muscles and the superficial muscles, one of the main things is that the deep muscles, people don't really think about it. So they don't really engage it. They don't really develop it. They don't really think about it, right? And also with the hypermobile ligaments. So if the ligaments are very mobile, how to combat that kind of thing? You actually combat it by having strong core or strong muscles. So that's where the development comes in. If you do the correct exercises, then as those get stronger, then you have less compensation. Remember I mentioned to you, and I said, like, honestly, you just need to solve this glute issue. And I think because you exercise so much, you should, bounce back quite quickly. And I think you have, majority of it.
Has helped a lot. And so guys, remember this. A lot of you say, oh, I don't want to get bulky, and then I don't need the abs. Like, I just wanted to slim down. To be honest, developing the core muscle or muscle in general, right, is important to protect ourselves, which is the nerves, your bones, and everything. Correct?
Correct. Yeah, because the muscles actually help keep things in place. As we get older, wear and tear happens. That one happens to everybody, whether we like it or not. But actually, what keeps, for example, when we talk about slip disc injury, when the disc comes out, what keeps the disc in place are exercises. Yeah, so of course we have clients which are like, oh, I don't want to exercise, I don't want to go gym. And I'm like, okay, that's fine. But when we give them certain exercises to do, they realize like, oh, we can do bridging. And then we start giving them weights. And actually that's weighted training anyways, right? Where you do pelvic lifts with holding weights. So people don't realize that actually that's what we mean when we say exercise and when we say develop muscles. They always think, oh, I gotta go to the gym, I gotta leave this, like, become like a bulky weightlifter. What is also very important is when you look at weightlifters, they don't develop those muscles naturally. Let's put it that way, right? They take a lot of protein and they figure things out. Most of the time when people are very active and they're very strong, you look at a gymnast, you look at swimmers, their bodies, I mean, of course, there are those which are very bulky, like Olympic size ones, but most of the time, if the muscles are done correctly and if your deep muscles are engaged properly, you don't have bulky muscles. You actually have very nice toned muscles that go according to your body.
Yeah, exactly. This is what we always wanted to tell our clients. It's not about making yourself bulky, but at the same time, it's important to develop the muscle.
Yeah.
The muscle help you a lot to protect your body. And then when you age gracefully, but with a strong body, right?
Yes, correct.
Yeah, very good. So just now you mentioned there's a couple of exercises you can share. Can you share with us what?
Yeah. So unfortunately, I don't have slides for that, but it's okay. I'll just tell you about it. I'm sure you can sort of figure it out. I tell all my clients when they come in for chiro, actually one of the best exercises is bridging. And where you just lie and you bend your knees and you lift up your bum. Yeah, so that's like basic. And when people go for like physio or anything, they learn the same exercises and they think to themselves, this kind of exercise don't make a difference. It does. It makes so much difference. So if you have any glute problems, if you have lower back problems, try to bridge. You will immediately feel the difference. It's like 30 seconds, engage your glutes, engage your core, and just do bridging. You do about 30 seconds 3 times a day, and you see the difference already. If you can do that, and if that is easy and fine, then you just add weights. Start light, start with 1 kg, 2 kg, that kind of thing. And if that's okay, you can add 3, 4. You'll be engaging your core, you'll be engaging your glutes, your lower back, you'll be very strong doing that. Yeah, there you go. Yes, so easy. Thanks, Yan. Yeah, so that's super easy. So bridging.
Okay, so this is number one. What else?
The second one is actually side planks.
Side planks.
Yes. So everybody does regular planking, right?
Yeah.
And regular planking is great and fine. But what happens is most of the time people drop their necks when they do regular planking because they get tired, things like that. But try side planking. You will be surprised at how much you engage your core when you do side planking and your glutes. And then you can always do variations of side planking where maybe your knees reach your elbows, those kind of things. And you see all the models do it usually. But when it comes, okay, so this one, she's using her hands, her wrists. Yeah. I teach my clients to do it with their elbow.
Okay.
Yes. So it's much more stable and you don't injure your wrist that way. Yeah, with the elbow. Yeah.
Yeah.
And when you do it, when you start, it can be very challenging. You could do normal planks, but side planks is a different story. Yeah.
Mm-hmm.
Yeah. So side planks, when you do it, you're engaging different muscles, you're engaging your transverse muscles. And so even with core workouts, so some of you, maybe you're like, oh, I've been trying to exercise, but I feel like my stomach, like, on the sides, always on the sides, you can't engage those muscles. Do side planks. It makes a difference also.
Excellent. Yeah. And then, okay, another one.
Another one you could do is dead bug track. So dead bug, like a dead, BUG.
Dead bug exercise.
Yes, dead bug exercise. This one's fantastic. So when clients first start doing it, they don't know how to isolate their muscles. Like I said, a lot of times we compensate, right? So when you do dead bug, when you first start trying it, you'd be like, oh, everything starts moving. You can't really coordinate properly. Yeah. So so this one, she's already doing a little bit of the opposite side. So what she's doing is that she's stretching her left arm and her right leg. And then she will do the opposite with her right arm and her left leg. So they always do opposite. Correct. Yeah. So I tell clients, when you start, try doing just the right side and the right leg. So do the same side first. If they can go down without the left side, like compensating for it or trying to coordinate, then you know that actually you don't have a coordination problem. You don't have a compensation problem. Then you can do the opposite side. And then you can see. So some people, I have a client just yesterday, he came in and I taught him this exercise and he always have neck pain. And when he does it right, immediately his neck comes up. And I'm asking him, why is your neck coming up? Just relax it. He goes, oh, I didn't even realize. Which means that anytime he uses his arms or his legs, his neck is engaging. And it's not even on purpose.
Yeah.
So now he has to learn to just do it with his neck lying on so you could do it on a yoga mat. It's super good.
Wow, awesome.
Yeah. So these 3 exercises, honestly, if you can do it, you already find a very big difference.
Excellent, excellent. So like we have a couple of questions here.
Yes.
Dr. Sam, would you like to address some of them? And the first one is I got a bone doctor and then say that it's good with no pillows and sleep on hot board or hot bed. So like, is that true? Is that good for the back pain?
All right. I would say it really depends on people. So hard or soft, it also depends on people. So usually the doctor tells you to take hard because what he wants you to do is to engage your muscles actually. When you have soft bed, what happens is sometimes you sleep and then it sinks and then your muscles end up engaging in the middle of the night and they don't rest. So it's a little bit of a different problem. When you have a hard bed, your muscles engage because it doesn't just slump. While if you have a soft bed, your muscles tend to slump, and then maybe in the middle of the night, it gets very tired. And because of the slumping, it's like an overstretching the whole night. So that's one thing about sleeping. People don't realize it's 8 hours of our life, or 5 or 6, or how many you can get. But it's a long time to be in a specific posture. So you want to be careful a little bit with that. I would say try it. If hard beds work best for you, do it. I had a client once, had all kinds of problems, had all kinds of expensive beds, went to Japan on one of those walking trips, sleep on tatami bed for like 2 weeks and then had no pain. He came back, he changed his bed and that was it. So there are people which it really is just based on hard or soft. So try. Yeah, if let's say you're willing to try, then you can try around. Sometimes you have to play around to find out what works for you also.
Hope answer your question just now, Samnis. Yeah. So another question which is so do many chiropractor on the Mac side or like are they certified? And should we only meet the certified chiro?
Okay. Hi, Zuhaini. Yes, you should only meet a certified or a chiropractor with a certification. There are a lot of chiropractors in Malaysia now, and they are actually bone setters or tita, and you have to be very careful. So if you go to, let's say, Chris Leong, very famous, right? And he calls himself a chiropractor, but he has no idea about anatomy. He couldn't show you based on, the iPad, the stuff that I show you. He has no idea about all those things because he learned from his sifu, who learned from his sifu, and now he calls himself a sifu and then he teaches the next person, right? So it's very dangerous. And what they do is they get into the room, they have 3-4 people and they just move you so that there's a crack, right? I don't know if Sally's in the call yesterday. She was just talking to me and she always comes to see me and she's like, Sam, how come got no crack one? And I tell her, I'm like, Sally, the videos, the cracks are not real sometimes, right? The cracks are just sounds because not everybody's bone has cracking sound. Sometimes it just moves, sometimes it glides. The crack is the only way to show you something is happening without showing you an adjustment. You get what I mean? So sometimes people don't have these kind of things, and sometimes a crack is not necessary. Sometimes you just need to move a movement. And so when they do it for the sake of a crack, and when they put like a towel around your neck and they pull it or something, there's no specificity to it. Means they're not actually touching your spine. They don't really know. And some people come back with even worse pain. So there are people who get better because all they needed was some movement. And going to one of these chiropractors, whatever they are, it moves. But there are some people which have legitimate nerve problems, and these not uncertified chiros cannot diagnose it because they don't have the diagnosis skills, they don't have the nerve knowledge, they don't have CNS, which is central nervous system knowledge. They didn't go to uni for it, right? So they can't actually explain to you or understand what you're talking about. To them, all same. Everybody with an arm pain, it comes from the shoulder, let's say. So everybody, they crack your shoulder. And there are issues like that as well. Yeah, so you have to be a bit careful.
Yeah. Thank you for answer this. This is very good questions. And then Michelle have this question is like, what should I do with the forward nap.
Yes. So if you have that issue, Michelle, you would want to watch your posture when you're sitting at a computer, especially. That's where people forget, because you end up sitting and then you just, do that. Rolling it back, as Yen has been talking about just now, your teachers teach you, that is good. We also teach people to do chin tucks. So you find a wall, it's very easy. You just stand against a wall and you just tuck your chin in. And you just hold it there for 30 seconds, create a double chin. It is what it is. And then you relax. And you do it and you relax. So I also tell clients, every 30 minutes, try to reset your posture. By resetting, I don't mean you have to do squats or exercise, but if you can, that's the best. Actually getting it moving every 30 minutes. So I'll tell clients, if you can, every hour, get up, move around. As you move around, you reset already. And then when you sit back down, if you have the correct underlying structures, you should be able to sit back normally.
So same as when we teach our clients, each hour you drink a glass of water. Same thing. So what you need to do, get up to get a glass of water and then move your body and sit back to your seat. Okay, good.
Yeah, it's exactly the same. Yeah, the concepts are the same, right? Because repetition creates habits.
Excellent. Awesome. Yeah. So Jessica, have a question. Where do you put the weights when doing bridging?
Okay, she asked about bridging and side planks with diastasis recti, right? The answer is, so I'll do the weights first and then we'll talk about diastasis recti in a second. So when it comes to weights during bridging, you put it basically on your pelvis. So you would hold it and then you put it on your core. So you add the weights to your core. Means you make your core heavier because that's what you're lifting.
So you tighten up, engage.
Yes. And you use your glutes to push you up, right? Can you do bridging and side planks with diastasis recti? It depends on how long you've had it. If you had it recently, means you just gave birth and you have it, you might want to rest first. But if you are at the stage where you can exercise in general, then yes, this actually helps your diastasis recti. Because it helps pull the muscles back together.
So like for those who just gave birth, and then this exercise is also very good to help you to engage and reconnect back your core muscle. Yes. So that is very, very important.
You could even do it when pregnant. So that you don't have the diastasis recti issue when you give birth.
Awesome. Prevention. All right, continue. Same, I always have a neck then question. I need to have a question mark. I also got spine issue. I need to sleep on a hot mattress. And nowadays get okay. Another one. Xin have the question is, will this affect?
Yes, it will. Depending on how severe your scoliosis is. So for example, it also depends on what you do for your scoliosis and how old you are. So if you're quite young, the scoliosis probably doesn't cause any nerve pain. But what it can cause is an imbalance in your muscle, and therefore you tend to lean on one side more than the other. You tend to sit on one side more than the other, therefore compressing the nerves. So it can affect, and then if you get much older and you don't do any exercise, right? Let's say you are 60 years old, you have scoliosis, it happens when you're a teenager, you are like 12, 50 years, you have this problem. Then yes, it can even affect the nerve because then degeneration might occur. So it depends on your age, but the answer in general is yes. Severity depends on what your exercise level is usually,
Okay, my recommendation, get an assessment.
yeah, that one has to get assessment. Yeah.
Okay, Eddie say, what are good exercises for what is that? Yeah, degenerative disorder in the back with the nerve pinch. Yes.
Okay, Eddie, there are a couple of things. So the exercises that are given you should help, but if you have leg pain or you have a nerve pinch, you need to get it released first. So you would do perfect if you came in for an adjustment and you did the process and then you do the exercises. Because if you do the exercises now, it might not relieve the pain immediately. There's no exercise to relieve the pain. Exercise is to prevent. So usually I tell clients, some exercises, like some stretching and things like that, it can relieve, but it doesn't solve your problem. So you have to solve it first, and then exercise is always the best solution when it comes to prevention again before doing it. Yeah, before getting it back again.
Very important. Okay.
Yeah.
So like continue. There's a lot of questions. So like should we invest expensive matches? I think we have answered that already,
Yeah.
right? And then Shanti asks, what is the best sleeping positions?
Yeah, so best sleeping position is any position that you can sleep, because most of the time sleeping is how you heal, but just don't sleep face down. Yeah, so best sleeping, I'm always a little bit I'm more general with it, because not everybody can sleep facing up. It's not comfortable. Some people have breathing problems, all this kind of stuff. So side is fine. Just and some people would argue side is the best, but I'm also I don't want to get into that argument. I just say don't sleep face down.
Yeah. Okay.
Yeah.
So like another question, what is the difference between what a physiotherapist and chiropractor does?
Okay. So between chiro and physio, we have both in our clinic. So depending on clinic to clinic and depending on what they practice, sometimes some physios and chiros, they really separate what they do at like our clinic. But the general difference is a physiotherapist, they study mainly about movement, the physiological aspect of it, like the movement patterns, how to help. Like, let's say if you always do squats and it cannot move properly, and at some point there is some disorder, maybe degeneration, the hips, things like that, then the physio comes in, right? Or if you have a shoulder injury, knee injury, things like that. But they don't diagnose generally. So most clinics, most physiotherapy clinics, people come in with a doctor's diagnosis or referral letter. They can diagnose. I'm not saying they cannot, but they're very similar to like a nurse. They can diagnose, but in practice and in teaching, they are not how to say, they are taught to listen to the doctor's advice in that sense. And they're very good. And don't get me wrong, they're very, very good. If you get a physio that's good, they are really good. But there are a lot which also don't know, because they are very used to just listening. Yeah. With a chiropractor, we focus a lot on the spine and the nerves and the musculoskeletal region. So the muscle, spine, and nerves, that's the chiropractor. The physio is movement and muscle therapy usually. We also, as chiropractors, do the movement of the spine, the mobilization. But when we mobilize, it's an adjustment. A physiotherapist mobilizes within your range. A chiropractor will adjust, and that's why sometimes there's a popping sound, which takes it above the physiological range. And that's why a chiropractor does something that a physio doesn't. And that's where, you talk about seeing somebody who's not certified to do it, they don't know the range. And so you usually get injured or you pinch a nerve and when you do it and stuff like that. But a chiropractor would be able to. And a chiropractor, when it comes to diagnosis, especially when it comes to nerves and stuff like that, we can diagnose it very well because we do it every day. It's bread and butter.
Got it. Okay, we have a couple more.
Yeah.
So like Nicole say her husband is a dentist, have back pain, and then sometimes feel get numbness around that shoulder. So like what her husband should do?
Okay, so dentists are our best friends in a sense that we work together a lot. Some people have TMJ problems, we refer them to the dentist. The dentists have neck problems because they look down all the time, they see us. So actually, Nicole, your husband should come and see us. It will really relieve. I've had quite a few dentists come in with upper back and neck pain and headaches sometimes even because of looking down so much. Adjustments are the best for them.
Very good. All right. So like knee pain when they running. So
okay, knee pain when running, check out your IT band. Okay, a lot of times if your glutes are not very strong, the same glute medius as you, Yan, that we were talking about, if that one isn't strong, the TFL on the side of the leg and the IT band get affected and then it pulls on the knee. And so when you run, you think like, oh, I've got a knee problem, but it's not. A lot of times it's a glute misfiring pattern. I would say, Ms. Na, if you want, you can come in for an appointment and we can check it out and see. You could try to roll it out on your own, your IT band, you get a roller foam. But most of the time, if you get it or you've had it for a while, you need chiropractic intervention.
Yeah. So like basically the simple release tension on your glute, get a foam roller or a tennis ball is fine as well.
Yeah.
And it's be more specific. You can get the pressure point balls, right? Especially you can sit on it and start rolling. There's a lot of you can feel the difference.
Yeah.
Why? Yeah. All right, continue. We have a couple more. So like Dr. Sam, how to find a certified chiro?
Yeah.
And then do we have some kind of website that you can refer to?
Yeah, you can look up the ACM, which is the Association Chiropractic Malaysia. And all of us who are certified are on it. There's tons of us. Most of the time, I would say, if you want to come see us, that's possible as well. We're in Mont Kiara. But if, let's say, you're not from KL, now I think our letters let you travel interstate, so it's fine. But if, let's say, you are not even from our Lembah Klang state, then you can just look on the website and there are people there. You can try, ask around. Usually people have a chiro that they are comfortable with, who your friends go to. And then you can double check, like cross-reference, and make sure that it's a recommended person and at the same time, it's a valid person.
Yeah. So like it's always word of mouth, right?
Yeah. If that's the best way.
Yeah. If some of your friends or family member get a chiro before and then they find it's really good, go to that person. Because a lot of them actually not from KL. So like that's why. All right. So good. Jean already answered you. Penny. Sometimes my face feel numb when I woke up with a backache. Is that related?
Yes, sometimes it can be. If your face feels numb, you also have to be a bit careful there. You would want to look at signs for what kind of numbness it is. I would say, Penny, you would do well for a very good consultation.
Yeah.
So that we can find out why or where is it coming from. Because if it's numbness due to jaw or TMJ issues, then okay, fine. Or if it's numbness due to the muscles in the back of your neck, okay, fine. But if it's numbness due to something that is more insidious, means nerve related, whether it is an infection or something, so you want to be a bit careful. So this one, I think better to come in for a consult. Yeah.
Okay, I better keep going. We have another 6 minutes only. And there's somebody, Puni, actually asking, can a 2-year-old using a pillow when she is sleeping? Like,
yeah, no problem.
Baby use a pillow.
That's okay.
All right. So continue. Anything can do for strengthen knee ligament, which already injured.
Yeah, there's a lot of things you can do with strengthening of a knee ligament. So this is an example of people who would see a physiotherapist. So this kind of thing. So, but Samnix, if you come into the clinic, like I said, we have both chiro and physio. We can just give you, you can see both of us and get a good opinion of what you need to.
All right, continue. Michelle, for a person having psoriasis, is it suitable to get chiro treatment?
Yes, depending on how severe your osteoporosis is, and depending on how old you are. Like I said, I have clients up to 80 over years old. So unless you have very severe osteoporosis, you should be fine to come in. It's not an issue.
All right. Yeah. Do people go to chiro for general adjustment, like a monthly adjustment, even without any noticeable problems?
Yes, there are people who come in like basically for maintenance. Because it's the same like your teeth, right? You don't wait till you have a cavity to go and see your dentist. So it's a similar concept. You get your car and stuff aligned and checked without getting into an accident. So it's the same thing. Yeah.
Very good. Okay, we have another 4 more minutes. So continue, June. Any promotion giving for consult for checkup purpose, like body checkup?
Yes. So that's a great question, June. The answer is yes. Everybody here today, if you attend the talk and you want to come and see me at HealthWorks, it is actually FOC for the consultation. Whether you want to see chiro, you want to see physio, you want to see both, it's also FOC. I would recommend when you come in, just mention Yan. I think that's the
wellness expert. Wellness expert.
Yeah, wellness expert. And it's FOC. So you just mentioned, I want to see Dr. Sam. I heard she did a talk and it's FOC and it's fine. Yeah.
Later on, we were going to share the contact for booking appointments. And at the same time, thank you so much, Dr. Sam, to give us a free consultation. Not free for everything, but free consultation.
Yes, the consultation at least, yeah.
Yeah,
and you know what is happening. Correct.
Yeah. Okay, continue. And then my upper part of my thumb still have numbness. Is it possible to be fixed? The numbness,
That one is difficult to say, Nuera. It really depends. If your nerve was cut, I don't know. I think this is not really a chiro nor physio question. It's a little bit more like a neurology thing. But I would say if it's exactly the point of where it's cut, it's hard to say. The numbness might be there forever. Yeah.
Yeah.
Unfortunately, yeah.
Awesome. So like there's a person, I think, talk about the frozen shoulder. Yeah.
I would say come in, frozen shoulder. Our physio does a lot of frozen shoulder cases and she is very successful at it. So come in and let's have a look. Usually people who have frozen shoulder, because it's related to the upper back and neck, chiro sees as well. So most clients, if they do chiro and physio frozen shoulder, it recovers quite quickly.
All right. Yeah. The last two questions, Dr. Sam, do you mind to
answer? No problem. Yeah. Just home exercises. Just try those 3 for a scoliosis person. Those exercises that I've already given you. It is really, really good, and you would see a difference. If you need more, then you would do other things like squats. Squats is usually very good. Or if you have to do, like the bird dog thing and the standard stuff. So not a problem. But yeah. I think that's it. That's all the questions.
Okay. Wow. We are on time. 1 minute. And please, everybody, I wanted to show you, and then you can just take a photo. And then here is the contact number. And then make sure this is especially for wellness expert, everyone in this call, and let me show you first. So as you can see over here, the clinic actually is in Verde Suite Monchiara.
Yeah.
And then you can snap a screenshot of this, or you can take a photo, and this is the number, right? Make sure make appointment. You can't just walk in at this moment.
Yeah.
Okay. And then everyone take a screenshot.
I also have our mobile number. Do you want the mobile number yet?
Your mobile number or
no, the clinic mobile number. So
yeah, that would be great. You can type it in, please, Dr. Sam. Thank you so much.
Type it in. Okay, sure, no problem. Or maybe just take a photo from here. It's easier.
Yeah. Oh, perfect. Yeah. So this is for everyone. I'm so happy. And not necessarily you think you have a big issues, but at least find answer, and then you can work on that, right?
Yeah.
So for those who join our wellness expert, our lifestyle hub, all the exercise, which instead of thinking you need to do exercise every single day, and give your time some time to rest. At least 1 day to rest. Don't go like, crazy day and night and then every single day. Your muscle, your body needs some time to rest as well. Okay. And so can we take a group photo, everybody? So Sam, can we have, okay, yeah, great.
There you go.
So I hope everyone learned something today, and it's grateful to have Dr. Sam. Yeah. And let's take a photo. 3, 2, 1, smile. And then page 2. Please turn on your camera so we can take a photo together. We have the highest is 116 people joining. 3, 2, 1, smile. Another page. 3, 2, 1. Excellent. So last but not least, thank you so much, Dr. Sam, today. Is there anything you can also give them a little summary or tips?
I would say summary is keep exercising. Movement is the right way. And mobility is something that you don't get back easily. So don't lose it when you can, kind of thing. Okay. Yeah, so at any time, just let me know. I really enjoyed this session. I hope you guys have learned something, and anytime.
Awesome. All right, Sam. Thank you very much, everybody. And have a good day. And don't forget